My name is Jack DeHovitz. I'm principal investigator of an AIDS International Training and Research Program funded by the Fogarty International Center, which is the global health research training arm of the U.S. National Institutes of Health.
This center funds projects that involve collaborations between researchers in the United States and other people in other countries. This has been a joint project between the New York State Department of Health, the School of Public Health, but also the medical school at Downstate Medical.
And this 20-year project now has focused on enhancing AIDS research training in Central Europe, Eastern Europe, and now Central Asia.
The goal of the program was to build the public health infrastructure in these countries. And so physicians came to our country through the Fogarty program and trained in public health disciplines with the goal of going back and both solidifying the institutions there and rebuilding the capacity of public health, and then hopefully subsequently taking over the education we're providing in country.
And this, over the years, has brought many students here to obtain a Master of Public Health degree, or sometimes even a doctoral degree, such as a PhD. And I think the most gratifying part of this is that how many of these people have gone back to their countries, have helped build capacity, and in fact have formed new schools of public health in places like the Republic of Georgia.
Our school was established in 2007, and the core faculty members have been those people who were trained in Albany.
I graduated School of Public Health at Albany, and I received my PhD in epidemiology. And when I graduated, I went back to my country. All which we learned here was extremely useful to start research projects, public health projects. It was really very important for my country.
I did my master's degree in biostatistics at Albany School of Public Health. But before that, I had another opportunity to work at Wadsworth Center in the field of molecular virology. It was an excellent opportunity for me to learn new methods, modern methods, both in basic science and in applied sciences like biostatistics, and at the same time to get some experience of living in the United States. When I went back to my country, I had an opportunity to implement a lot of experience I gained here.
What we had hoped would happen 15 years ago has actually materialized and has become very successful.
This partnership helped us very much to build capacity in Georgia so that people trained here became teachers, and we started training the new professionals on our own.
Our project with the School of Public Health in Georgia was really successful. So now a new generation of students are coming. So we are mentoring them and we are teaching them through the same model which we saw here in the School of Public Health. It's a great feeling.
Physicians that were once my students are now my colleagues. And it was an amazing opportunity to see this transition.
One of the unique aspects of this program has been the joint SUNY collaboration.
Clearly, we're very strong in the population sciences. The people at Downstate are very strong when it comes to clinical medicine and the clinical sciences. And our partners at the health department, of course, are used to running large programs. And when you combine those three together, that's a very powerful set of tools that can be brought to address a particular issue.
And I think this is simply an example of how collaboration across the system helps everyone.
Training at this university does not stop when you graduate. It becomes partnership, collaboration, and friendship.
I never thought that when I met these students years ago that we would be lifelong friends.
I think this particular program is one of the better programs, and we would welcome other such opportunities.
What we learned from the original Fogarty grant working in Central and Eastern Europe, we've now been able to translate to other collaboratives in Asia, in Africa, in the Caribbean, and in other parts of the world. And by doing this and by sharing scientific knowledge, I think we create a better public health network on a global basis.